All right, so we're looking at the medial side of the lower right leg, and we can make out three muscles right here. We have 1, 2, and then 3, and really we're making them out by their tendons. If we follow them up, we'll see some of the muscle belly. But starting off with that first one, we have tibialis posterior. Next, we have flexor digitorum longus, and then that last one is going to be flexor hallucis longus. And the way we can remember that is by the acronym Tom, Dick, and Harry. So that first one, tibialis posterior. Dick would be flexor digitorum longus, and then Harry would be flexor hallucis longus. In terms of function, tibialis posterior is going to cross over that ankle joint on the posterior aspect and go down to the side of the foot. It'll help plantar flex the foot at the ankle, as well as we'll get some inversion of the foot at the ankle. Moving over to that flexor digitorum longus, if I pull on this tendon, you can see the plantar aspect of the foot moving, right? So you can see those tendons moving. So flexor digitorum longus is going to help flex digits 2 through 5, as well as help with that plantar flexion of the foot at the ankle. And then lastly, we have that flexor hallucis longus, and if I pull on the tendon of that, you can see right here that tendon moving. So again, if I pull on this tendon, you can see that muscle moving. So if we know that's connected to that muscle belly over here. If we follow the tendon, we can see that it goes to that big toe, right, the hallux. So it'll help with flexion of that first digit, as well as contribute a bit to plantar flexion of the foot at the ankle. All right, so now we're looking at the lateral lower right leg, and we can see we have the calcaneal tendon. If we go lateral to that, we can make out this muscle right here, the tendon of this muscle, which is fibularis longus. Deep to that, we have fibularis brevis. And they're going to pass posterior to that lateral malleoli. All right, and you can see some of the tendon right here as I'm tugging on it. And they're going to contribute to plantar flexion of the foot at the ankle, as well as help to evert that foot, so eversion of the foot at the ankle.